Hello, my name is Jeff Hauk, and I'm from George Fox University, and this talk is about linking video-based motion analysis with clinical cases of injured runners. So running is beautiful, but it's also turns out to be dangerous, as organic and natural as it seems. Novice runners get hurt at 17.8 injuries per 1,000 hours compared to recreational runners for around 8 injuries per 1,000 hours. So over twice as frequently, new runners are hurt. And other runners that have experience, so they've already gone through the novice phase and committed themselves to a running career, also suffer not just local injuries, but kind of these migrating aches and pains. Where do the injuries occur? Well, there's no joint spared or structure, it seems. So we have the big players being medial tibial stress, Achilles tendinopathy, patellofemoral syndrome, and plantar fasciitis, but also other problems like functional acetabular impingement and gluteus, greater trochanter bursitis types of problems at the hip, ITB syndrome at the knee are also common. So people have recognized this and put a full-out press on trying to prevent injuries, and this starts with things like shoe orthotics and internal supports, training strategies where you don't increase greater than 10% a week. You keep your mileage low at first and then progress. There's also other things about the person, like muscle imbalances, things like this, and then there's technique and style. Because shoes really are controversial right now, and people are really going through a transition phase of where we're at with what's best in terms of shoe wear. And training's been explored, and even when all of these things are taken into account, there's still problems. And so people now have turned to a technique and thought, well, is there an optimal technique, or is there at least a technique that we can use to address injuries, one of the two? And this study right here really broke it open in terms of the idea of how much variability there is available within running technique to change. And this was done by Brian Heiderscheit in 2011, where speed is held constant, and then what they did is they varied step rate, made it slower up to 10% of the preferred rate, or made it faster up to 10% of the preferred rate. We can see here is this is the work during the braking phase, or the first half of the running cycle, and this is the propulsion, or the second half of the stance phase of the running cycle. And then we see ankle, hip, knee, and hip work here at the different rates. What we see is when someone has a bigger stride or slower rates, there's a lot of work done at the knee, and that work gradually decreases until we had a really fast rate. And what this suggests is that essentially the loading at the knee can be controlled or decreased for problems like patellofemoral syndrome simply by increasing rate. And then we look at propulsion phase. We notice a little bit different, but same benefit, only a different joint. And so here we can see that the knee stays pretty much the same. There's some decrease, but when we increase rate, the big winner here is the ankle, where there's much less propulsion work done to add a faster rate. And so this could help with things like Achilles tendinopathy. So in this example here, what we're looking at is a comparison between someone who has a slow and a fast rate using a 3D motion analysis system. And so the two skeletons represent the same runner running at a different cadence. So the white skeleton is a runner running at a fast cadence, and the red skeleton is a runner running at the same runner at a slower cadence. And both trials are at the same speed. The blue is the ground reaction force here, and what we want to focus on is the knee joint center, which is right here. So we're going to move the skeletons to where they're just at foot strike, and we'll leave it right there. So it's right after a foot flat. And we can see the difference in loading starting out. Let's just take a little bit more into the trial. There we go. Like right here. We'll focus right here for a minute. We can see is at this particular point, the skeleton in white, the the ground reaction force is just behind the knee joint center, which means the moment arm of the ground reaction force is small, and therefore the work at the quadricep muscle is low. We compare the same moment arm, that's this distance here, from the joint to the ground reaction force. It's much larger, so the work on the quadricep muscle is going to be much larger. And essentially this difference kind of persists until we get to the transition from braking to propulsion. And that kind of fits with the data that we saw and gives us a rationale for using stride rate to improve loading at the patellofemoral joint for people with those kinds of problems. So Dr. Heiderscheid also asked a second question when looking at this data, and it's, are there visual cues that we could look at a video of a runner that indicate to us what that same loading might be? So those moment arms are the magnitude of that ground reaction force. Can we infer it somehow from just a video and then know what the loading is going to be at the hip, knee, and ankle? And so what they were able to do is validate that there are certain characteristics of a video that correlate or connect with the 3D motion capture, in effect giving us a cheap alternative to the 3D motion approach. And then they followed it with another article that showed that it's reliable to pick off these points in different examiners. So now we have an alternative to clinically to execute this kind of analysis where we look at motion and make some valid inferences about the loading that's happening at the hip, knee, and ankle. Specifically, the hip and ankle need more validation, but the fact that it worked at the knee is promising for showing that it's probably going to work at the ankle and hip as well. So all we need is a camera that has a good frame rate, and so the minimum would be at the 150 frames per second, but we prefer 300. And then you need good lighting, and basically a treadmill, good light, camera. And then if you want to do some more sophisticated analysis, you can use some fancy software, and you're off and running. So here, what do we look at when we look at the video? So the first thing we want to check for is overstriding. We can see in this example the person is landing, this is taken at the moment of the first foot deformation, and we can see that the heel is near the belly button and the trunk, and that's suggesting to us that the knee loading will be low. Compare that to this example on the right where the person's heel position at the point of first deformation of the foot is quite a distance from the center line of the trunk. And this is suggesting to us several different things about knee loading. So if we look here, the inclination angle of the foot with the treadmill is high, the knee is straight, and the center of mass to heel distance is high. All of those indicate higher knee loading in the braking phase of the run. So the second thing we look at is the peak knee flexion and dorsiflexion that's occurring somewhere near the transition from braking to propulsion. And this kind of fits with the mass spring model of running that's been popularized, where we imagine the trunk as a mass and the leg functioning really as a spring that's stretching out when we land, compressing as our trunk transitions to that midpoint between braking and propulsion, and then the spring releases as we go into propulsion. And so the peak knee flexion angle we're looking for here, or the average, is we want it to be 40. And if it's less than 40, then we're thinking that the leg is too stiff, or the spring and the spring mass model is too stiff. And if it's greater than 40, then it's too compliant. So the next thing we want to look at is bounding. And bounding is the vertical oscillation of the center of mass. And we can see here it varies. Its low point is where the spring of the leg is most compressed at that transition point between propulsion or braking and propulsion. and then the peak vertical height is achieved during mid-flight. The average oscillation measured in a study by Adams was about 10.3 centimeters, and that at higher cadence it decreases. And we can know is that really this has a strong effect on the magnitude of the ground reaction force. And so the magnitude has to do with loading not just at the knee, but also the ankle and the hip. So high amounts of bounding are going to contribute to injuries at all three joints. And one thing to note is that picking off vertical oscillation from video is not reliable in the studies by Heiderscheid et al. And instead, the recommendation is to use technology, which has been found to be reliable, for example, in this study by Adams et al. So in summary, applying visual analysis in terms of knee load helps us understand, what's going on in terms of how to approach. So applying the visual analysis is effective for decreasing knee load by focusing on maximizing center of mass vertical excursion or vertical oscillation, decreasing foot inclination angle, decreasing the center of mass to heel strike distance, trying to encourage some landing with slight knee flexion, and then understanding that just a simple adjustment like increasing step rate has a powerful effect on knee loads by affecting many of these variables that we would pick off from the video analysis. Now, another option that was explored by Teng et al. Is a forward trunk lean. So we can see in this picture to the left that the trunk is quite vertical as compared to this one to the right where there's some anterior lean. And both of these are taken at the instant of first foot deformation. And we can see that the picture on the left where the trunk is back, the ground reaction force has a tendency to follow the trunk center of mass location. And so if we look at this, we can notice that as it's drawn, there's a large moment arm for the ground reaction force at the knee, meaning that the knee extensor muscles, again, will be working harder because of the posterior trunk position. With the anterior trunk lean, the center of mass is brought more anterior. So at landing, if it's brought anterior sufficiently, what will happen is the ground reaction force now will go through the joint center, or at least closer to it, so the moment arm of the ground reaction force will be less, and then the knee extensor load will be lower. And so forward trunk lean has been documented by Teng et al. In a series of studies to decrease the knee load, increase the hip load, because the hip load now is increased because the moment arm here has been shifted, and with no effect on the foot. So here we look at the different foot strike patterns that were initially associated with shod and unshod running, and now we realize they're more associated with just runner preference, where you can land on your heel or your forefoot, and there's some benefit of not wearing shoes because you have this increased sensory input and function of the foot. The main argument against a heel strike is seen in the vertical ground reaction force graphs that we see here, where there's a large, rapid vertical impact peak that could overload the body as you're in the braking phase of running. When you land in your forefoot, as seen here, the foot's lowered to the ground by the foot muscles and leg muscles, and therefore you eliminate the vertical impact peak and instead absorb it in your leg muscles. So Dr. Irene Davis has been a champion of arguing that this elimination of the vertical impact peak is important for injury prevention, is more organic and natural compared to cushioning the foot and then trying to deal with the impact peak in the shoe. And what Irene Davis is on a mission for, it seems like, or the argument that she's putting forth, is that there's potentially an optimal or more beneficial pattern than what we understand now, and researching that and understanding is good for our patients and the running community in general, which is all true, and it's been supported by some evidence that shows that high vertical impact peaks are associated with injury in a prospective trial. However, it's also true that that runners have individual adaptations that they need, and they may need us to alter their pattern specific to them to try to deal with their injuries. So this is an example of the forefoot landing effects. So this is a higher speed runner in minimal shoes, and we can see that she doesn't quite achieve a forefoot land, and instead she's more of a midfoot lander. And if we kind of think about where the ground reaction force would lie, it'd go up toward her center of mass, something like this, we would see that the ground reaction force is going through her knee joint center because she's landed so far in her forefoot. As the ground reaction force passes back to her center of mass, it passes a little more forward, again decreasing the moment arm of the ground reaction force, which leads to, see right here, a decrease in the knee extensor moment, or the load or work done at the knee joint by the quadricep muscles. So what's interesting is that both a forefoot strike and a shorter stride have remarkably similar effects at the knee, meaning they reduce the overall knee moment and load at the patellofemoral joint as well as the knee extensor muscles, which means that they both can be used to benefit people with patellofemoral syndrome. So now we're going to shift our attention to the frontal plane, and we see a picture here of a lady in left heel strike and a runner, and same runner in a right heel strike. And the things to look for on the video for frontal plane control, we're going to work from superior to inferior, our trunk side flexion, where we look for the evenness of the shoulders relative to the pelvis. Then lateral pelvic drops. We're looking for the drop of the pelvis on the opposite side of the stance limb. We can see here it's pretty even. Her shoulders are pretty even for the lateral trunk. The pelvis is pretty even for the pelvic drop. And then we look at the knee here to see if there's a gap between the knee at the point when the right and left thigh are approximated, or close to the transition from braking to propulsion. So if we compare this picture on the right, or her left single leg stance, to the right single leg stance, we see a marked difference in this runner, where the right shoulder's dropped, the left pelvis is dropped, and there's a no gap position, meaning here that two things are possible. One, there's some trunk control or core issues. There also could be a right-sided gluteus medius or hip abductor problem. And then finally, there could be medial collapse of the knee, which doesn't look like that's occurring in this case. There's only slight hip abduction here of the knee, and there's not severe pronation, which could also be at play. Another variable we look at is crossover, and we grade it as appropriate or wide, a crossover appropriate or wide. And essentially what we're looking here is at the point of foot contact, and then we cycle through the video and look at the point of the next foot contact and see if there's crossover. At faster speeds, the person nearly crosses over or places the foot almost in the same location as the opposite foot, and at slower speeds, the foot width or step width gets wider. And a crossover could indicate problems at the hip joint, strain on the ITB, or contribute to excessive pronation or medial collapse. Rearfoot eversion is when we look at the angle of the leg relative to the foot, and that's kind of drawn in this picture here. And an average normal is around 8 degrees, although this is somewhat controversial. And what we're looking for here is whether or not the foot position is contributing to abnormal motion at the knee or the hip. And finally, we're looking at the subtalar joint or eversion that's occurring in the foot. And here's a forefoot striker. We can see here's the initial contact on the lateral side of the foot, and then the lowering of the heel to foot flat. And this all has occurred during the braking phase. And then during propulsion, the transition where the heel comes up, and then they're up on the forefoot for push-off. So if we look at the position of the hind foot, we can see that that starts with hindfoot inversion at heel strike, then it goes to eversion at foot flat, and then as the heel comes up, it gradually returns to where at push off, we're in full inversion again. So the loading at the braking phase here at initial contact, the ground reaction force is acting through the forefoot laterally, and this is causing a bending moment that tends to evert the rear foot or the subtalar joint. So at this point of stance, the action of the muscles has to be quite strong in controlling that to lower the foot to the ground. So there's a strong contraction of the medial tibialis posterior and other inverters of the foot, which can contribute strongly to medial tibial stress syndrome. And lastly, a new study by Pola et al., where they've demonstrated that high arch and low arch feet have different compliance variables at the ankle. So in other words, high arch feet are stiffer, so essentially they're going to have less ankle range of motion and higher moments, and the low arch feet are going to have greater compliance and a slightly lower moments during the stance phase of gait, which has implications in terms of knee control and proximal control to hip. Now, fixing these problems is not so straightforward, as we saw the research by Irene Davis and her group, and reviewed in this recent study, where they looked at different ways of altering things like no gap, lateral pelvic drop, and a knee extension moment data. And essentially what they were able to demonstrate is somebody that has this kind of deficit on a single leg squat, you can remediate the single leg squat in rehab, but that won't translate to running necessarily. And the reason for it is the intensity of the single leg squat doesn't match the intensity of running. And so to get changes to occur in running, you have to both establish the same motor control pattern, one, and two, match the intensity or the demands on the muscles required to correct these positional faults. Another approach that does work is augmented feedback. And the augmented feedback can be auditory or visual, and usually occurs over an 8-session interval, where 4 sessions give continuous feedback and 4 sessions are intermittent feedback. And the types of feedback are visual or auditory or mirror. For frontal plane, you can use a monitor that's positioned in front of them with the camera at their side to give online sagittal plane feedback. And then you can use things like an auditory step counter from their phone or wearable technology. And this, the review on augmented feedback was done by Agestra et al., JOSP2 2015. That's excellent. We have lots of different options for obtaining clinical effects at the knee. We know, for example, in patellofemoral syndrome that we need to decrease hip internal rotation, improve hip strength, and alter muscle recruitment, and then ultimately lowering patellofemoral joint stress. Well, the different options are increasing cadence, or landing with a forefoot, or trunk lean, and or using augmented feedback to control pelvic position. All of these things have been demonstrated to be effective, and it's likely they have strong effects at decreasing knee pain. So other problems that also could be addressed, although haven't been researched directly yet, are ITB and lateral hip pain that's common in higher demand runners that run at faster speeds. Pelvic drop, side bending, and knee no gap would theoretically decrease strain on the ITB and alter the hip abductor muscle demands as well as the glute maximus. So these approaches should be tried. Also, functional acetabular impingement is an interesting problem because it has a slightly different focus than the muscle strains like the Achilles tendinopathy and hip abductor and ITB problems. It's more joint related, similar to the patellofemoral joint. where only in FAI, the key success strategy is going to be to limit the impingement or bring the range of motion envelope under what's causing the abutment of the femur against the acetabular rim. And so the motions that would do that would be decreasing pelvic drop, decreasing side bending issues, altering no gap, or overstriding, and then anterior pelvic tilt positions. So successful strategies will bring the range of motion during a stride within the safe envelope where there's no impingement. We apply these principles to specific diagnosis like chronic exertional compartment syndrome in an article by Diebel et al. They recognize that changing people that had an anterior compartment syndrome from a dorsiflexor or rear foot striker to a forefoot striker might be a benefit. And the logic works something like this. When you heel strike, your ground reaction force is posterior to your ankle, so it creates a plantar flexion moment at initial contact, which means you have to internally use your ankle dorsiflexors to lower the foot to the ground, and that creates a lot of stress in the anterior compartment. So the overloading of the anterior compartment was seen as the primary culprit in these exertional syndromes, and so changing runners from heel strike to forefoot striking would switch the control from the anterior compartment to the posterior compartment. So when you're forefoot strike, you need your posterior tibialis muscle and your other inverters are working harder, and then you relieve some of the load on the ankle dorsiflexors, which in effect gave long-term relief of symptoms. And similarly, for a forefoot striker, this is a case where the person had long-term medial tibial stress syndrome. There's a female runner, a strong advocate, and loved running, averaging in the 20-mile plus range for weekly mileage. She had tried orthotics to no effect, dry needling to no effect, exercise and stretching to no effect. And so essentially, we switched her from a forefoot runner to a heel striker, and she had a dramatic decrease in symptoms that has lasted now for over a year. So while we're exploring the optimal technique for running, we encourage you to consider altering your technique and exploring new ways for happy running pain-free.